Assalamualaikum. So in this video I will discuss with you the blood transfusion. Okay, what is blood transfusion? Discuss in this video. So we see the content, definition, purposes, component of blood, grouping and cross matching, type of blood transfusion, general instruction, complications of blood transfusion. So these all topics are not possible to discuss in one video, so I decided to make the parts of these videos. First of all, we can see the definition. What is blood transfusion? Blood transfusion is a transfusion of the whole blood or its components such as a blood cells, a plasma form, one person to any other person. Blood transfusion involves two procedures, that is collection of blood from donor and the other is administration of blood to the recipient. Okay, so this is the definition of blood transfusion. Next, the purposes: to restore the blood volume when there is a sudden loss of a blood due to hemorrhage, to raise the HP level in a case of severe anemia, to treat deficiency of plasma protein, clotting factors are homeopathical globulins acts, to provide antibodies to those persons who are sick and having a lowered immunity, and that to replace the blood with hemolytic agents with fresh blood, to improve the leukocyte count in blood as in a agronucleoticals, to combat infection in leukopenia. So these are the purposes. The next are components of blood. For transfusion, each unit of a blood is tested for evidence of hepatitis B, hepatitis C, human immune deficiency, virus 1 and 2, and syphilis. The blood is then proceeded into a subcomponents. These are whole blood, packed cell volume, fresh frozen plasma, platelets, and cryopactics. The next is whole blood. Whole blood is a unseparate blood containing an anticoagulant preservation solution. 1 unit of a whole blood contains 450 ml of donor blood, 50 ml of anticoagulant prevention solutions, hemoglobin approach 12 ml, and hemotactic 35% and 45% non-functional platelets. The next is stored between +2 and +6 degrees centigrades in a blood bank. Refrigerators. Transfusion should be started with 13 minutes of removal from the refrigerator and completed within 4 hours of components, because change in the compositions may occur due to red cell metabolisms. So packed red cells are that span down and concentrate one of units 330 ml and has a 50 to 70%. They are stored in a SAG-M saline and solution to increase their shelf life to 5 weeks to at 2 to 6 degree centigrade. And fresh frozen plasma. Fresh frozen plasma is rich in a coagulation factors. It is separated from whole blood and stored at 40 to 50 degree centigrade within a 2-year shelf life. It is the first life therapy in the treatment of a coagulable hormones. So in this video we discuss the definition, purposes, component of blood for transfusion, the whole blood. The next is packed red cells, fresh frozen plasma, and the next slides we discuss with other videos. Okay, for that, Thank you so much.